Stop what you are doing for just 10 seconds and try something with me. If you are sitting down right now, I want you to rise out of that chair without the use of your hands. Don't lean on the armrests. Don't press down on your knees. Just stand. Are you able to do it? If the answer is yes, you just demonstrated something that researchers have quietly linked to how many years you have left. Not how you look, not your cholesterol number, something as ordinary as getting out of a chair. Here is the truth that almost nobody outside of medicine ever explains. Somewhere along the way, our whole culture decided that after 75, the job is to be careful, sit down, slow down, don't overdo it. And this is what I have seen happen to thousands of people who followed that advice to the letter. They became careful, then they became weak, then they became dependent. Not through disease, because of instruction. Meanwhile, a group of people in their late 70s and 80s are doing something quite different. They still drive themselves to their own appointments. They still remember every grandchild's birthday without a note on the fridge. They still bring their own groceries in from the car. And if I look carefully at what makes them different from the rest of their age group, it is almost never money, it is almost never genetics, and it is almost never a supplement. It is 6 specific behaviors. And most people their age have quietly given up every single one of them. I am Dr. John. I am a board-certified physician in geriatric medicine, and I have sat across the table from tens of thousands of older adults in more than 25 years of clinical practice. And I have something to tell you today that most seniors will never hear from their own doctor because your doctor's 15-minute appointment has never had time to explain it. In 2024, The Lancet published something that should have been front-page news everywhere, and instead barely made a ripple. A commission of the world's leading dementia researchers concluded that 14 modifiable factors, things within human control, account for close to half of dementia cases worldwide. Their estimate was that as much as 45% of dementia could potentially be prevented or delayed if those factors were fully addressed. 45%. Not managed, not medicated, potentially prevented or delayed. And this is where I need you to hear me clearly. That finding was not aimed at 40-year-olds. Several of those factors matter specifically in later life, which means the window is not shut. Not at 75, not at 80, not at 85. But before we go any further, I want to ask you for something. Drop a comment right now with just your age, 71, 78, 84, whatever it is, and tell me honestly which of these 6 things you still do. We reply to every comment on this channel with personalized suggestions, so don't hold back. And I read them, all of them. Because a comment section full of people in their 80s talking about what still works for them is worth more than most of what gets published. Now, we are counting down from 6 to 1. And I need you to stay with me through all 6, because number 1 is the one that almost nobody associates with physical independence. It has nothing to do with your diet and nothing to do with your muscles. Fewer than 1 in 8 adults over 75 do it consistently. And when researchers look at who preserves their cognitive function into their late 80s, it keeps coming up. Stay with me. Number 6. You still get out of a chair without using your hands. That little test we did at the beginning was not a gimmick. It is one of the most honest measurements in all of medicine. And here is why. When you stand up out of a chair, you are asking 4 systems to work together in a fraction of a second. The large muscles of your thighs and hips, your balance system, your blood pressure regulation, and your joints. Your doctor can order a blood panel and discover a great deal about your chemistry, but there is no blood test in existence that will tell them if all 4 of those systems still work together. Standing up does. Think of it like starting a car. You can inspect the engine, the battery, and the fuel line one by one, and find nothing wrong with any of them. But turning the key tells you whether the whole machine actually runs. Standing up from a chair is turning the key. A research group in Brazil built an assessment around exactly that, lowering yourself to the floor and getting back up without support, and tracked thousands of adults for more than a decade. Those who could not do it without help were several times more likely to die during the follow-up period than those who could. Same age, same medical histories on paper, different capacity to get up off the floor. And this is what I need you to understand about why this happens. The chair test does not cause anything. It reveals something. At around 75, muscle loss stops being cosmetic and becomes structural. The first fibers to go are the fastest firing ones, the ones you need to catch yourself when you trip over a curb, and they drop away silently. There is no pain, there is no symptom, there is only the day you reach for the armrest without thinking about it. That was the day it started, and it is almost always dismissed as just aging. If you are still standing up with your hands free, you are holding on to something most people your age have already surrendered. And if you just had to have the armrest, don't panic. That is trainable at any age, and I will tell you exactly how in a few minutes. Stay with me, because the next one is something you probably do every single week without knowing that you are being tested. Number 5. You still bring your own groceries in from the car, not one bag at a time with somebody hovering, actually carrying them. I know how small that sounds. But grip strength, the simple force your hand can generate, may be one of the most powerful predictors of longevity ever identified, and hardly any doctor measures it. The Pure study, published in the Lancet, followed nearly 140,000 adults in 17 countries. The researchers found that grip strength was a better predictor of death from any cause than systolic blood pressure. Every roughly 11-pound decrease in grip strength was associated with about a 16% higher risk of dying from any cause during follow-up, and a greater risk of cardiovascular death as well. Read that one more time. A squeeze of the hand outperformed a blood pressure cuff. Why on earth would that be? Because your grip is not really about your hands. It is a window into your whole nervous system and your total muscle reserve. The signal has to travel from your brain, down your spinal cord, through the nerves of your arm, into muscle tissue that has to be healthy enough to answer. When grip begins to go, it usually means the wiring and the reserve are both thinning out everywhere. Your hand is just the easiest place to see it. So when I ask a patient if they still carry their own groceries, I am not asking about groceries. I am asking whether their body still has reserve. And here is the practical part, because I never want to hand you a problem without a tool. You do not need a gym, and I am not asking you to lift heavy weights. 2 sessions a week, 20 to 30 minutes, with resistance bands or a couple of light dumbbells or even a wall focusing on legs, hips, and back. Resistance bands are ideal after 75 because they load the muscle without pounding the joint. But there is a piece almost nobody tells you. After 75, your muscles develop something called anabolic resistance. In plain language, your muscles have gotten hard of hearing. The same signal that built muscle in a 50-year-old now barely registers. You have to talk louder, with more intention and more consistency. And you have to give them the raw material within a reasonable window afterward, which brings us straight to number 3 in a few minutes. Margaret was 81, a retired school librarian from Boise, Idaho. She came to me because of dizziness when she stood up and what she called thinking wrapped in cotton. She had been told it was her age. We started her on bands twice a week, and I will get to this in the middle of the video. We fixed something about her mornings. 10 weeks later, she told me she had walked the entire farmer's market with her daughter and carried the bag herself. She cried when she said it. So did I, a little. Stay with me, because the next one is not about how much sleep you get. It is about something else altogether. And this is where most people are getting it wrong. Number 4. You still go to bed and get up at roughly the same time, even on weekends. Everyone talks about how many hours you sleep. Very few people talk about when, and the latest research suggests that when may matter more. Investigators examined data from the UK Biobank, tens of thousands of adults wearing motion sensors on their wrists, and compared how regular people's sleep patterns were against how long they slept. Sleep regularity turned out to be the more robust predictor of dying during follow-up. The most irregular sleepers carried substantially higher all-cause mortality risk than the most regular ones. And regularity was a better predictor than sleep duration. Same number of hours, different consistency, different outcome. And here is why. This is the part your doctor has never had time to explain. Your body runs on an internal clock, and that clock does more than control sleepiness. It schedules your blood pressure, your blood sugar handling, your immune activity, your hormone release, and your brain's overnight cleaning cycle. After 75, that clock weakens. You make far less melatonin than you did at 30, and your deepest, most physically restorative sleep shrinks dramatically. Think of your body as a huge building with a night maintenance crew. When the crew shows up at the same hour every night, they know their route and the work gets done. When the schedule changes every night, they arrive, the doors are locked, and they leave without finishing. And that overnight cleaning matters more than people realize. Research from the University of California has shown that older adults who get less deep, slow-wave sleep tend to carry a higher burden of amyloid, the protein associated with Alzheimer's disease. And in a controlled study, even a single night of sleep deprivation measurably increased amyloid signal in the brains of healthy adults. It appears to work in both directions, which is exactly why protecting sleep is not optional. What the exceptional ones do: the same 30-minute bedtime window every night, the same wake time every morning, weekends included, a cool bedroom around 65 to 68 degrees Fahrenheit, because your temperature regulation is less efficient now, and cool air supports deep sleep, and screens off an hour before bed, not mainly because of blue light, but because an engaged mind will not shut down on command. Before we go any further, I want to make sure you understand something, because it sits underneath every single one of these 6 habits, and it is the single most overlooked problem I see in adults over 75: dehydration. After 70, 2 things happen at the same time. Your kidneys become less able to concentrate urine and hold on to water, and your thirst signal, the alarm bell, becomes genuinely quieter. You can be meaningfully dehydrated and not feel a thing. That combination is why dehydration is one of the most common and most missed conditions in older adults, and why it is repeatedly linked with urinary tract infections, confusion, unsteadiness and falls, and longer hospital stays. Your brain is roughly 3/4 water. Mild dehydration measurably dulls attention and short-term memory at any age. After 75, it can look exactly like early dementia, and I have had people come in for evaluation of cognitive decline who simply were not drinking enough water. So this is what the exceptional ones do. They do not wait until they feel thirsty, because that signal is no longer dependable. They drink 12 to 16 ounces first thing in the morning, before coffee, before breakfast, before anything, because you lose fluid all night through your breathing. Then a glass with every meal, and 1 mid-afternoon. That was the other change I made with Margaret. Bans twice a week, and water before coffee. That was all. One note of caution, because I will not be careless with you. If you have heart failure or kidney disease, or you take a diuretic, your fluid target is a conversation with your own physician, not a number from a video. Ask them. Now, back to the countdown. Number 3 is where I see the most dangerous misinformation of all. Number 3. You still eat real protein at breakfast, not toast, not cereal, not a banana, and coffee. Protein. There is one piece of nutritional folklore that has quietly damaged older adults more than almost anything I can name. It is the idea that you need less protein as you age. It is backwards, and it may be one of the most harmful things ever passed down as common sense. Because of that anabolic resistance I mentioned, muscles that have gone hard of hearing, the international expert groups that actually study protein, needs in older adults, along with the European Clinical Nutrition Societies, recommend that healthy older adults get at least 1.0 to 1.2 grams of protein per kilogram of body weight per day. That is meaningfully more than the usual recommendation written for younger adults, and more still if you are recovering from an illness or an operation. Most of the people I see are not even near it, and there is a specific reason. Appetite goes down with age, and carbohydrates are easier to chew, easier to prepare, easier to swallow, and cheaper. So, breakfast becomes toast, lunch becomes soup, and the only real protein of the day arrives at dinner, if it arrives at all. Here is why that pattern fails you. Your muscle can only use so much protein at one sitting for actual repair, roughly 25 to 35 grams. Beyond that, the surplus is mostly burned for energy rather than rebuilt into tissue. So, a day with 70 grams all at dinner is not the same as a day with 70 grams spread across 3 meals. Not even close. Think of protein as the bricks your body uses to rebuild itself overnight. Every night while you sleep, you break down damaged tissue and replace it. If the bricks arrive once a day at 6 post-meridiem, most of the wall never gets rebuilt. Over months and years, that structural deficit becomes the difference between managing your own home and not. Aim for 25 to 35 grams at each of your 3 meals. That is roughly 4 to 5 ounces of fish, chicken, eggs, Greek yogurt, cottage cheese, lentils, or beans. And try to eat some of it within a couple of hours of your resistance session, because after 75, the repair window is shorter and a great deal less forgiving than it used to be. James was 78, a retired civil engineer from Scottsdale, Arizona. His daughter brought him in because he had lost almost 18 pounds, and his previous doctor had told him it was normal age-related weight loss. It was not normal. He was not shedding fat. He was losing muscle, and his grip had gotten noticeably weaker, which, as you know by now, is no small thing. We did not start him on a single new medication. We rebuilt his breakfast. 3 months later, he had put lean weight back on, and he told me, and I could hear the pride in it, that he had carried every one of his own grocery bags in from the car for the first time in 2 years. Stay with me, because number 2 is the one people refuse to believe can be medicine. And it may be the best documented item on this entire list. Number 2, you still have someone you talk with every single day, and you still sometimes disagree with them. I know, it sounds soft. It sounds more like a greeting card than a physician. So, let me give you the hardest numbers in this whole video. A landmark meta-analysis led by Dr. Julianne Holt-Lunstad and her colleagues combined 148 separate studies covering 308,849 people. Those with stronger social relationships had a 50% greater likelihood of survival over the follow-up period. The author's own conclusion was that the influence of social connection on mortality risk compares with well-established risk factors, smoking and obesity among them. That is not hyperbole you see on the internet. It is in the published literature. In her later work, she found social isolation associated with roughly a 29% higher risk of mortality and loneliness, about 26%. The World Health Organization took this seriously enough to launch a formal commission on social connection, calling loneliness a pressing global health threat. And that 2024 Lancet Dementia Commission I mentioned at the start, social isolation is one of its 14 modifiable risk factors. I want you to understand this, not just believe me. So here's the mechanism. Genuine conversation is one of the most demanding things your brain ever does. You are reading a face, tracking a thread, retrieving words, anticipating what comes next, and regulating your own emotion, all of it at once, in real time. Nothing else you do lights up that many regions simultaneously. Think of your social brain as a muscle. The neurons that fire during a real conversation, shared laughter, a mild disagreement, being genuinely surprised by another person, are the same networks that hold your memory and your judgment. When they go quiet for weeks, the brain begins trimming what it does not use. And after 75, rebuilding an unused pathway is far harder than maintaining a live one. That is also why I said disagree. Nodding along to the television in the same room as another human being does not count. Passive presence is not connection. You have to be thinking, responding, laughing, occasionally pushing back. The effort is the medicine. Aim for one genuinely engaged interaction every single day. A real phone call counts. A book club, a faith community, a walking partner, a standing lunch, a volunteer shift. Dorothy was 83 from Charleston, South Carolina, and she lost her husband of 54 years. 8 months later, her daughter brought her to me because she had declined measurably on cognitive testing in less than a year. We changed no medications. We built her a schedule, a weekly book club, one 20-minute phone call each day rotating through friends and family, and 2 volunteer shifts a week at her library. 8 months after that, her scores were back close to where they had begun. Her daughter said, "She seems like herself again." And if you can combine this one with movement, a walk with a friend, a class with other people, gardening alongside a neighbor, you get more than either gives you alone. 2 of these 6 at once. Stay with me, because now we get to number 1. And this is the one I have been building toward. Number 1. You still do something every day that you are not good at yet. Not a crossword, not a puzzle book, not rereading a beloved author. Those all have value, but they are not this. I mean the deliberate practice of something genuinely new, a language, an instrument, painting, woodworking, a cuisine you have never cooked, something that makes you feel a little clumsy and a little foolish every single day on purpose. Here is why it is number 1. After 75, your brain starts to strongly favor the roads it has already built. It becomes extraordinarily efficient at the familiar and extraordinarily reluctant to build anything new. That is not laziness, and it is not a character flaw. It is an aging brain conserving energy by using the paths it already paved. But that very preference is how cognitive reserve gets used up. Cognitive reserve is your brain's buffer, its capacity to absorb age-related change and keep working at a high level anyway. Think of it as the difference between a bank account and a paycheck. Reserve is the account. It is why two people can have almost identical changes on a brain scan, and one of them is symptomatic, while the other is still doing her own taxes. And reserve responds to novelty specifically. Familiar activity maintains existing pathways. Novel, effortful learning is what builds new ones. In a well-known study from the University of Texas at Dallas, investigators had older adults spend months learning something challenging and unfamiliar, digital photography and quilting, while comparison groups engaged in pleasant, familiar, social activities. Only the groups doing the hard new thing showed significant memory improvement. Enjoyment was not the active ingredient. Difficulty was. The same theme runs through the language research. Work by Dr. Ellen Bialystock and her colleagues found that lifelong bilingual adults develop dementia symptoms roughly 4 to 5 years later than monolingual adults with equivalent pathology. Their brains were not less affected. They coped longer. And here is the crucial part. Neuroplasticity, your brain's ability to physically reorganize itself, diminishes with age but never disappears. Your brain retains real capacity for structural change well into your 80s. But only if you give it something to change for. Choose one genuinely new skill, give it 20 to 30 minutes a day. Switch to something else every few months. And the word that matters is actively. Watching a video of someone playing guitar is not learning guitar. Sitting with the instrument in your hands, fumbling through a chord change, being bad at it is. The struggle is not the barrier. The struggle is the whole point. It is resistance training for your mind, and the resistance is what does the work. Robert was 79, a retired engineer from Portland, Oregon, and he came to me because names were slipping, and it was getting hard to follow complex conversations. His imaging was unremarkable for his age, so I wrote him one prescription, and it was not a drug. Pick up the thing you always wanted to learn and do it every day. He picked oil painting. He had never touched a brush in his life, and he will tell you himself that he was terrible. 18 months later, he had painted more than 20 canvases, joined a local art group which quietly handled number 2 at the same time, and on repeat testing he had improved in several areas. Improved, not held steady. Improved at 79. Here is what I want you to do tonight. Just one thing. It is free and it takes less than a minute. Sit down in your regular chair. Cross your arms over your chest so you cannot cheat. Stand up and sit back down as many times as you can in 30 seconds. Count them. Write the number on a piece of paper, date it today, and stick it on the fridge. That is your baseline. Do it again in 4 weeks. Bring both numbers to your next appointment and ask your doctor what they make of them. You will have given them something no lab can give them, a measure of your independence over time, in your own handwriting. Now, let me say something from the heart. I have sat with enough people between 75 and 85 to know that this period of life gets treated as a countdown rather than a continuation, and I think that is one of the great quiet cruelties of medicine today. Because what the research keeps telling us over and over again is that the body and the mind at 75, at 80, at 85 hold a stubborn, astonishing capacity to respond, not in spite of age, in conversation with it. These 6 things are not about going backward in time. Nobody can do that, and I would never sell it to you. They are about the most complete possible use of the time the clock still has. Standing up on your own, carrying your own groceries, sleeping like your body has a schedule worth keeping, eating like you are still building something, arguing with someone you love, being bad at something new, on purpose, every single day. That is what independence really looks like, from the inside, not a number on a chart. Groceries in your own 2 arms, and your grandchild's birthday in your own memory. You have worked far too hard for the life you have to give it up quietly, and knowing the warning signs is not fear. Knowing is power. Now you know. Please do one thing for me. Share this video on Facebook right now and tag one person you love who is over 60. A spouse, a sibling, a neighbor who lives alone. Your share may be what keeps someone else's mother out of an emergency room this year. And if you are not yet subscribed, do that right now and turn on the notification bell. Every week I bring you research-backed, senior-specific health information, and that subscriber number is what tells the algorithm this information should reach every older adult searching for it tonight. Then drop a comment and tell me 2 things: your age, and which of these 6 you are strongest in right now, and which one you are going to build. I will be reading every response. You might think you are just leaving a comment. You may actually be giving someone else the permission they have been waiting for. This video is provided for educational and informational purposes only. This channel does not provide individual medical advice, diagnosis, or treatment. Always consult your physician, pharmacist, or other licensed healthcare provider before making any changes to your health routine, your fluid intake, your protein intake, or your exercise program, particularly if you have a heart and kidney or liver condition. There is something I deliberately left out of this video, because we discussed what to keep doing, but I never told you about the medications that can undo every one of these 6 habits from the inside, the common prescriptions in millions of American medicine cabinets that quietly worsen balance, drain muscle, and blunt memory in adults over 75. That deserves its own conversation. That is the next video. I'm Dr. John. I will see you in the next one, and take good care of yourself because you are worth the effort.